Hello, my name is Kerry Pace and this is another video vignette for Plymouth University. I'm from Diverse Learners and I am a specialist tutor, but I also work as an advisor to Plymouth University Midwifery and Nursing Department. I support people who have disabilities, particularly dyslexia and dyspraxia, in nursing and healthcare settings, both students and staff. And today we're going to talk about things you can do to enhance a positive placement experience for all students, but particularly those who have dyslexia and dyspraxia, and how to be proactive in making sure that your student is as comfortable as possible and you gain as much knowledge about their support needs as possible. So here we are with positive placement experience in the middle and 6 of the key things that would be top tips from me for any student who has dyslexia or dyspraxia. On this side, you can see there's a pre-placement learning document that we're going to talk about in another vignette, and we're going to talk about that in terms of the reasonable adjustments that are needed specifically for a student and how that may help with the student feeling comfortable and you being proactive in those reasonable adjustments and them not being forgotten, miscommunicated, and the student doesn't have to keep coming out and explaining what they are to every single member of staff. And on this side, we've got a pre-placement visit, which again is really good for all students. That might include things like food and dietary requirements, whether there's a canteen, car parking, whether there's a permit needed, how much that may be, bus timetables, pictures of staff, for example. But again, we're going to be talking about that in more detail in the video with the pre-placement learning document. So here we are, positive placement experience. We're going to talk about reviews and the importance of timely reviews and what those reviews can look like. The importance of praising effort. I hear this every week in the one-to-one sessions and in the training I give to NHS trusts across the country. Effort isn't praised enough. We're very quick to say, oh, they can't do this or they can't do that or they're having issues with this, rather than actually praising the effort. And that means you actually highlight what someone is doing well so they know they have to repeat it. And that can be a disconnect for people with dyslexia and dyspraxia where they think they have to change everything. So it's really important to say, this is really good, we need to work on this area, and actually this is going really well as well. One thing at a time, again, is vital for people who have dyslexia, dyspraxia and other disabilities who may get overloaded and overwhelmed with too much information. That is because of their executive planning skills and the deficit in that area. Which is the stuff that helps you plan and process information. So one thing at a time, maybe it could be one thing a day, so you could do the observations all on one day and give that person the opportunity to overlearn skills, which is our next element. Overlearning skills is about not necessarily practicing over and over again, although that can be an element of it, but overlearning the skills in different situations and in different ways with different techniques in order to cement that learning. So for example, I took 9 times to pass my driving test as I have dyspraxia, but I've never had an accident. So those 9 times and all of that extra training, although it took me longer, I did get there in the end and I'm a really good driver. And then finally, we're going to look at checklists and templates and the importance of those for people who have memory issues in order to establish a routine and also to give a linear process to something, as linear thinking can be more difficult for people who have dyslexia and dyspraxia. They tend to be holistic thinkers, which is what we want for our nursing and healthcare students. So we're going to look at a bit of these, look at these a bit more in detail now. So here we have time. Time is really important. So you may be aware that a lot of people who have dyslexia or dyspraxia or other disabilities gain extra time for exams, up to 25% extra time for exams, and also time for rest. It's more difficult to replicate on placement, but it can be done. So for example, a reduced workload, so having 4 cases instead of 5, or more time to actually learn the skills of a placement. So that could be an extended placement by a couple of weeks, or it could be a shorter day, for example, is so you do more days, you do the same hours but over more days in order to reduce fatigue. It's also really important to take time to discuss those personal learning needs. That goes back to the placement document we were talking about, but also that metacognition, a metacognitive question that we've talked about in another video. You know, how do you learn best? What can I do to help? Which is the most effective way for you to make that information accessible to you? So is that a mind map? Is it a list? Is it a tick list, for example? This can also be done in that pre-placement learning document that we talked about as well in that other video. Time to practice new skills under supervision whilst developing competence. We talked about that a little bit in the first slide, where we're talking about giving people the opportunity to overlearn the information or learn it in different ways, and perhaps rather than show them twice or see one, do one, teach one, that kind of method, you're actually taking on board all the needs of their abilities, but also the time it may take them to cement that. So for example, I had a student on a ward who did all the OBS for a whole day, and by the end of the day was really confident with their OBS, rather than just seeing once and then not doing it for a week. Make time to give constructive feedback. We talked about that in the previous slide as well. That praise, this is what you're doing well, keep doing it, is really important for people who have dyslexia and dyspraxia, because they just assume that everything is wrong. They take it very literally. And timely reviews. I hear again and again students who say, I haven't had my half-term review, I don't know how I'm doing. And those reviews then become sort of like 2 weeks from the end. And it's much more difficult to put anything proactive in there. So aren't an issue, we haven't got the time necessarily to put some reasonable adjustments in, or make sure those reasonable adjustments have been put in the first place in the last 2 weeks. So timely reviews is really important in order to have positive intervention if needed. So here again is a proactive way of thinking about what you can have prepared for your student. So for your pre-placement visit, for example, would be really useful, but also this is a chance for overlearning, which we talked about in the previous one. So here we are, and also in templates and checklists. So here we are, we have different medical terminology and little tips in how to do this. So this is from University College Dublin. They've actually put a 40-page document together of all the frequently used terms and abbreviations on their placements. This is a student who made this, and this ring here they clipped on their belt, and this was all the abbreviations. So again, if somebody says something to them, they could just quickly refer to it and tell them what they are. It was so successful that everybody adopted that in the placement, whether they were qualified or not. And here we've got some suffixes, and you can also do the same with prefixes, so people can make a good educated guess about what some of these things may mean. So they might say, oh, well, I don't know exactly what it means, but I know it's a beta blocker. So again, showing some knowledge, and also prefixes as well. These are really useful tools for everybody though. This is another template idea or checklist where I've created this on my mapping software with a student during a session. And this was about having 6 beds, and what do you ask each person? So again, not referring to people by their beds, but this was a template in order to start the process. So what is the person's first name? What bed are they in? What ailment do they have? What's their past medical history? What's the plan? What medication do they need? What nurse inputting, and any other things? So it was a way of them talking to patients and gaining that information, but also gathering that information for a care plan. And it was a much simpler way for them to understand it than the document that they had been given. So hopefully that will give you some top tips on how to make a positive placement experience for your learner as a mentor. And I'm from Diverse Learners. My name is Kerry Pace. I've produced this in collaboration with Plymouth University, and you can contact me on kerry@diverse-learners.co.uk.